So Health Technology Wales is a national body, and we were set up to look at evidence to inform the adoption of health technologies across Wales. We've got 3 key remits: to identify technologies that are likely to be of value within Wales, to appraise the evidence for those technologies to inform decision making, and thirdly, to follow up our guidance to understand if it's been adopted nationally. So the Health Technology Wales audit process is annual, and we work with the stakeholders who use our guidance to audit their uptake of the guidance. At the time we produce our guidance, we also produce an audit adoption plan that we share with our key stakeholders so that they expect the questions that we're going to bring to them to understand the use of the guidance. So Health Technology Wales was able to pump prime the funding of the AMaT system nationally for 2 years with the local health boards, and this allowed them to access the system and to be able to explore how it could help them in terms of not just their audit returns for Health Technology Wales's work, but also for other audit work nationally.
AMaT stands for Audit Management and Tracking, and it's a system that we use within our Health Board to help with our quality and safety work. We use it within our clinical effectiveness team to disseminate national guidance out to clinical services and teams. So that includes NICE guidance and Health Technology Wales guidance, amongst other key pieces of information that we need to send it out. So we've been undertaking this work with Health Technology Wales for about 2 years. We're going into our 3rd year now. In the first year, they offered us some funding for a system to support that work. And we'd already been looking at AMaT in early 2020, but unfortunately that was put on hold due to the pandemic. But we revisited that when we got the funding, and the Health Technology Wales funding enabled us to purchase the system. So we are one of 7 health organisations in Wales who use the AMaT system.
The first time that I was involved in the adoption audit was 2022 to 2023. Health Technology Wales were really instrumental in setting out the timeliness and the deadlines for the adoption audit completion. It's important to monitor the compliance against Health Technology Wales and NICE guidance so that we can be reassured as a health board that the patients and the people that we serve are receiving the best evidence-based care. Hywel University Health Board has got 3 counties: Carmarthenshire, Ceredigion and Pembrokeshire, and it's geographically very widespread, so it's really important that we're providing safe, effective care at each of those counties with limited variation.
So AMaT has really helped because it allows you to register the audit, follow it through, and then you can utilize that information for the quality improvement projects. Data collection and results management from these audits becomes far more easier using AMaT. And all this is web-based, so a great area to save time, energy, and to have it in one place. It's all stored in the cloud, so absolutely amazing for quality improvement projects. This evidence of good practice, good healthcare, good quality audits, good quality improvement projects can be shown as evidence to patients and families. This not only improves their knowledge, it also improves trust between the healthcare system, our colleagues, our clinicians, and all healthcare workers to the families of our patients. It helps patients understand what kind of development has taken place in that particular treatment. Besides this, families can be reassured about what kind of developments are being done for their loved ones using a tool like this. So definitely a modern tool with a brilliant carbon footprint reduction, good sustainability, and amazing prospect for the future.
For the last couple of years we've used Health Technology Wales guidance within the system in slightly different ways, and the supplier are always looking to help us with that. So this year we're hoping that our clinicians can enter the information directly into the AMaT system in a pro forma, and that goes automatically to Health Technology Wales, so it removes the need for any email circulating around the system. So that's one of the key developments that we're hoping for. Another area we'd like to explore is for us to understand across Wales where other health boards are in relation to the Health Technology Wales guidance, because sometimes our patients can't access the technology here in Hywel, but they can elsewhere within Wales, but we don't know if that other health board is supplying it. So within the system, if we can have that oversight, it would be really helpful.